Hi, Dennis again. How are you? Hope everything is fine. This is Muhammad Musa from AFK Study Plan. Today we are going to continue with articles from NDEB website. Today we are going to speak about concept which is not most of us are familiar with is the consent, and as you can see here, it's informed consent. With like this informed word is means a lot. So this topic is like little tricky. It's so easy if you understand it. It's super easy. The website providing three articles about this one. They are too short. It's not something like it's crazy or you need to study a lot. You just need to know the idea, and that it will be super easy for you to understand the questions and answer the questions correctly. As usual, bring your notebook, your pen, write your notes, try your best to answer the question appearing in your screen. With that being said, let's start. Okay, so informed consent process allows the patient or the custodial parents or in case of the minors or legal guardian to participate and retain autonomy over the health care received. So it's not like you are going to do treatment for patient without explaining to him. You need to explain everything to the patient, and if patient is minor, you need to explain it to the his parents or legal guardian coming with him. Okay, so and then he goes like you can read this part. It's like it's not very important, but now the background is informed consent is the process of providing the patient, or in the case of minor, the custodial parents or legal guardian with relevant information regarding diagnosis, treatment needs, so that an educated decision regarding treatment can be made by the patient or the guardian. So here, that's why it's informed consent. It's like, oh, okay, I'm going to do extraction for you. Are you okay with that? The patient said, okay, no, and he's like, he's good. Even if the patient sign it, if even if the patient sign it, and like for God's sake, like something goes wrong, and then he go to the court, and then he said like, okay, dentist didn't explain it to me, and dentist said, okay, he signed it. No, if the patient did not understand everything, if the patient didn't ask question about it, so this consent is useless. It means nothing. That's why informant is critically important. The dentist should inform the patient of the proposed treatment and any reasonable alternatives in a manner that allow the patient to become involved in treatment decision. So here come the importance of the word informed. Okay, and then he's saying like a hybrid approach combining of the patient oriented and practitioner oriented standard is followed by some states. So he goes to speak like about the states, like in United States of America, about it. It's the same like in Canada. It's slightly different about it, but he said like it's not patient oriented. You are meaning like you are not going to do treatment that is medically irrelevant, or you are going to do a treatment which is like not necessary for the patient. And in the other context, you are not going to give the patient, force the patient do a treatment that the patient is not approving. Like in medical term, you think this patient required this treatment, his condition required this treatment, but the patient denied it, so you cannot force a patient to do it. Okay. The adult accompanying the pediatric patient may not be a legal guardian allowed by law to consent to a medical procedure. So it's not like some patients send his child to the office with his nanny, or maybe with his uncle, and the parents is living and still here. If the patient come to you in this condition and you wanted to do some treatment for him, you are not going to ask the adult coming with him, okay, give me your consent, sign and go home. No, he should be the legal guardian. So not any adult accompanying the child is the legal guardian. It should be someone with custody over it. Example of this include a grandparents, step parents, and non-custodial parents in instance of divorce, babysitter, or a friend of the family. A child in a foster care, a caretaker who may or may not be allowed to consent to a medical procedure according to an individual state law. So, in this case, to save yourself here, obtain a copy of court order appointing a guardian to verify who is authorized to consent for a medical treatment for the patient. And this, for sure, this is if the patient is a child in a foster care. If the patient came to your office before with his parents But this time he's coming with his uncle, he's coming with his nanny, and the parents in the first visit approve the treatment plan in total. So you can go with this one because a patient, you have the approval from his parents before. But if the treatment plan is going to be changed, like for sure, for example, if you are going to papotomy and then no, it's now indicated for extraction because the bleeding is cannot be stopped, and you try to bapectomy and it's not working, these tools need to be gone and space maintenance should be applied here. So you are not going to ask his friends, you're not going to ask his babysitter. You need to stop and then call the parents and then discuss it, maybe give him temporary filling, and then when they come back to get the consent from them. So the consent is not unconditional. The consent is for specific treatment plan. If the treatment planning is to be changed, so you need to regain again consent from the patient, guardian, which is parents or the legal guardian. And the legal guardian, as we mentioned here, you should have the paper from the court saying this one is a legal guardian for this child. Okay, even if not mandated by state law, written consent is advisable and it may decrease the liability from miscommunication. Meaning, a consent is not should to be written. Consent can be oral, but it's advisable to be written. For example, let me give you example. If a patient comes to your office and this patient is scheduled for a new patient exam, so before the patient sit on the chair, you're gonna ask him, sign this one because you are going to do a new patient exam for you. This makes no sense. So when patient come sitting in your chair, this means he gave you the consent to do the exam. He giving you the consent to do the x-ray. And in condition, this condition does not meaning like you are not going to explain to him. A consent form should not preclude a thorough discussion. So meaning like because of the patient is in your chair, you're going to do every x-ray. And we speak about this in the article before for the x-ray frequency and when to do x-ray. No, you should look into your patient and then ask your assistant, okay, let's do this x-ray, let's do this x-ray, not to do this x-ray. So not every new patient is eligible for every x-ray. It's not insurance wise, it's like medical wise from the patient perspective and health and his condition. It's not like do x-ray for everything. So this line explain this. Consent form should not preclude a thorough discussion. It's not like signing or saying. You should discuss with the patient about this one. Consent form should document the oral discussion of the proposed therapy, including risk, benefit, and possible alternative therapy. This means like if the patient come and he's like booked for extraction. So before you do extraction for the patient, you should sit with him, speak, saying, okay, this tooth had this 3 lines of treatment. First line of treatment, to do nothing about it, which I do not recommend because this might give you more pain later. Second, do extraction. Third, to do root canal treatment. Fourth, to do blah blah blah. So you should give him alternative and give him every detail about like the complication that might happen for this one. This means a modified or customized consent form is preferred over a standard form and should be in the format that are readily understandable to a lay person, mean like non-medical person. He can read it and understand it, and you should ask him about it. And at the end of the consent, there is a question. You should say like you ask your patient, do you have any more question about this one? Patient is good, then you can proceed about it. And this is the like the explanation of this for the informed part in the consent. Okay. And then this one, we said it before, consent will need to be updated to reflect the change in treatment. It's not like this consent is okay for everything. No, if there is any change for that, you should update the consent with the patient himself or the legal guardian. And then he giving you a guideline about how you are going to do the consent, name and date of birth, name and relationship of the legal guardian, description of the procedure in simple term, disclosure of the no risk, and then evidence-based alternative for this treatment, and then places and signature. And then if he's like a legal guardian, you should have your paper documented about this person is the legal guardian of this child. Okay, so that was the first one. I think it's so easy. And then the second one is speaking about like when to think, okay, this patient has the legal capacity. This patient has the legal, has the mental capacity to, okay, I can take the consent from him. So this one has two factors. First factor is age. Second factor is the awareness about what's going on about him. So I think this is confusing. So let me explain it more for you. So the article specifically mentioned the patient must have the capacity to consent for the treatment. This capacity in two terms: people who have been declared mentally incapable, in which cases their guardian or substitute decision maker must provide the consent, or minor who are incapable of providing consent due to their age. And this age part is honestly like tricky in this one, because in Canada every province has a different guideline for that. So I'm going to read you the numbers. In New Brunswick, a patient age 16 can be doing this. In Quebec, it's 14. Okay. So I don't think this is critically important, but like I would like you to understand the numbers and just to know it. And if the treatment entails a serious risk for her health, or it may cause grave or permanent effect, consent from a minor's parent or guardian is required. Meaning, like, you cannot come to like 16 years old patient and ask him, okay, let's do Invisalign treatment. No, this is not reasonable. Or let's do extraction for your wisdom teeth. No, but like 16 years old coming to your office, he want to do cleaning. Okay, let's do cleaning. I don't need to kill his parents for this one. So I think you understand it now. Like it's procedure specific. It's not like every procedure. And then is the mental capacity. If the patient declared to have some issue with his mental capacity, so he cannot give you the consent. This means that she must have the ability to understand the information about the treatment and understand the likely consequences of having treatment or not having the treatment. If a patient does not understand English, interpreter should be used. Like, and then he speak about Ontario stuff like this. So the mental capacity doesn't mean like if he cannot understand it, you don't jump to conclusion he has some mental issue. Maybe he don't understand English or French, so you should give him opportunity to translate to his language. And then voluntary is like you should ask your patient to give the consent in by his freedom, not like to force him to do it. Okay, and then he goes again about information part, information provided, treatment and its benefit, the material risk to be done, and this stuff. And then the article goes to give you some examples and scenarios and case reports about some cases happening in the court. I don't think this is extremely important. I'm just going to cut it short for you and tell you this. Okay, so the articles here discuss like 5 or 6 cases about extraction of wisdom tooth leading to complication. So as we mentioned in the guideline, you should tell the patient about the risk factor that might happen, or risk situation or complication that might happen to the patient himself after extraction. So in these 2 cases, first case, you do extraction for a wisdom tooth, and this patient come later and saying, okay, I have numbness in my lower lip, I cannot feel it. So there was 2 cases in this article. First one, the tooth was away from the bulb, from the inferior alveolar canal, and the second one was very close to an inferior alveolar canal. So the court concluded the patient with the band showing the tooth is away from the inferior alveolar canal and leading to the same, the result was the same. The 2 patient has permanent damage to the inferior alveolar canal and he cannot feel his right side or left side from his lower jaw. The first one concluded the court like he's not guilty about this one. And the other one, he was deemed to be guilty. Why? Because like in this case, you should reinforce more to your patient. This tooth is close to the inferior alveolar canal, which may lead to higher risk of numbness after you do treatment, after you do extraction. So it's like case specific. It's not like written on the stone. This every patient coming to you, you're gonna tell him every and any complication that might happen after extraction or during root canal treatment. You should weigh it and think about the risk factor from the x-ray. Same for root canal treatment. The separate instrument, you should mention to the patient the separate instrument is a possibility happening with any root canal treatment, even for upper anteriors. But when you are speaking about lower 7 with a curved canal, it's extremely important that you like explain more to the patient and give him the freedom. So you can tell him this tooth is very close to inferior alveolar canal. I would like to refer you to oral surgeon. He can do it like with more experience over me. If the patient said no, I trust you, you can do it. Here he give you the consent. So the court decision is not based on the patient only signing the consent or you giving the information to the patient. They go to X-ray, to go to the notes, and then they tell you, okay, so you are good or bad, you are deemed guilty or not guilty. So this is the criteria I would like you to know. And then I don't want to waste your time about scenarios and court discussion. It's honestly, it's very boring. And then, moreover, like for the consent, if you know your patient is coming to you, he's going to be sedated for this one, he cannot drive, he cannot go home by himself, so you should recommend the patient. If the treatment will affect the patient ability to drive or to function safely, your responsibility extends to ensuring that the patient will have the assistance he needs after leaving the premises. If he cannot anyone come to accompany him, accompanied by someone who can drive him her out to the home or escorted to a taxi by your staff. So if he cannot bring anyone to come with him, or for any reason he just came by himself after you telling him, it's not like you told him so. No, it's your responsibility to escort him to a taxi and make sure he go to his home safe. So as you can see from the article here, the theme for this one or the main idea here, so it's you are the professional one here. So you should know how to tell and what to tell to your patient and be sure to follow up. It's not like you're telling him and he go home and no, you should like follow up the stuff here. And then there is a weird situation here. If the patient gives you the consent and you are doing treatment for him and the patient would like to withdraw his consent, once a patient withdraw consent for a procedure, the issue then become what is required for a valid consent for the continuation of the procedures. Meaning, like, and then he speak about here about some medical stuff, not about dental stuff. Then he's saying like patient, like think about it from dental perspective. If patient is going to go for extraction and he come to your office, you give him freezing, you start do the flap, you cut his soft tissue, and you start to cut the tooth itself and you start to drill the bone. Here the patient say, no, I don't want to continue, I want to stop. So first of all, for sure, you should stop. It's not like you voluntarily. It's very important here. You should um, respect patient autonomy and his will. But in this instance, you start cutting inside the tooth, you should explain to the patient for sure after you make him calm down and check what's wrong with him, what's bothering him here, and give him the space to calm down. And then you explain to him, no, we cannot stop now. We should complete the procedure. But if you just cut the soft tissue, you didn't touch the tooth yet, you didn't use your elevator, and the patient said, no, I don't want to do it here. You after you calming him down and he insists that no, I don't want to do it, you will tell him, okay, let's suture it, and then you go home and then discuss later. But if you start cutting the tooth, so you cannot say no, I will stop here. And this instance, you should refer him immediately to other oral surgeon or you ask other dentists to do it. You should dig deep with the patient to reach a point where the treatment should be completed. So the bottom line here, if the treatment can stop at this point and the patient can go home, you should stop. If the treatment cannot be stopped and you try to speak with the patient again to make him go back to a chair and do it, if the patient insists, so you should refer him. It's your responsibility to refer him to other oral surgeon and to give him the treatment that need to be done. Okay? Who should obtain the consent? You, as a dentist, should obtain the consent from your patient and should not delegate this task to your assistant. It's not like you asking your assistant to get him sign it. So usually most dentists ask the assistant to explain to the patient, but when you come to the office, you should speak again with him, confirming he understands everything, and you should ask him the famous question, do you have any question for me, before you start to give him freezing and do everything, okay? And then the decision is before the patient and should be like you get it from the patient before you start it, not after you giving him freezing, you do it for him, okay? Emergency treatment, you speak about like patient coming after trauma and the tooth is broken, and maybe he's not in his right mind to tell you he's very afraid, or the legal guardian is not here. This is emergency situation. You should at least start to do it. And then, like, it's clearly stated here, the requirement for informed consent outlined above don't necessarily apply in an emergency situation where the patient is unable to give consent. And there's honestly for more for the like GA or sedation for the patient when he cannot give you the consent and there's some change in the treatment. So you can do it, but you can do it just to emergency, not to do it for all. Okay. And then the form of consent, consent may be written or oral. Then this is clarify the part I told you before. The new patient is not required to write and sign the X-ray consent and everything. No, he can give it to you oral, but written is preferred when the patient is going undergo under is planned to go for filling, is planned to go for root canal treatment, is planned to go to extraction. Okay, so if a question saying the consent form should be in a written form, no, consent form can be oral, but again, while an executed written consent form provide evidence that the necessary information was given and the patient consented, it is not in and of itself determinative of informed consent. So, meaning like if the patient signed it and you didn't explain to him, you didn't tell him everything, so he can in the course saying no, doctor and his assistant didn't give me the full information, so he can sue you. Okay, oral consent. In most cases of routine dental care, a written consent form may not be obtained. You should ensure that the patient has verbally given an informed consent to the treatment to be provided and that you have kept a detailed written record of your discussion with the patient of his or her verbal consent. So, and again, this is specific for the routine stuff, not for extraction and stuff like this. Okay, and then the consent form. Consent form will not necessarily prove that informed consent was obtained. If the patient is subsequently able to convince a court that the nature and or a potential risk of the procedure will not adequately describe him in evidence of the treatment. So there's a tricky part. So patient may say, okay, you didn't tell me everything. Then come the notes, very effective in this part. The form should be used in conjunction with the notes you normally record in the patient chart or record. If you use a written consent form, your chart notes should describe the circumstances under which a signed written consent form was obtained from the patient. So it's not like you're saying in your notes the patient consented. No, you should make it more like custom. Like we speak to your patient with your patient saying and mention some discussion done between you and your patient, and then this will cover you. So patient saying no, he didn't explain it to me, and you sign it, so the court will go to your notes and they will tell you a secret about this one. So usually the court, if you go to court, and usually most dentists in Canada go to court anyway, so they go to the notes for this patient and more patient. Why? Because they would like to compare it. So if they see you have a button patient consented for every notes, so they think okay, there is something wrong with this one. But if they see your notes saying patient consented and we speak about this alternative blah 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 and there is more discussion, for this instance, if the patient say no, he didn't explain to me, they will lean more into your side, not the patient side. So the notes are extremely important here. You should ensure that you mention records which set out the advice you have given to the patient, meaning like you give the patient advice, so you can go first, no treatment, second, root canal treatment, third, extraction. Or if he has a missing tooth, first, no treatment, and you give him the consequence of no treatment. Second is flipper or partial denture. Third, fixed denture. Fourth is implant. Then you explain to the patient and tell him the condition and everything. This is the meaning of informed consent, and the consent shouldn't be just like sample. You should adjust it. So you don't give a patient consent for extraction of the upper wisdom tooth, and in the risk factor, you see numbness or injury to inferior upper nerve canal. So this is mean no sense. This make no sense because if the court called this consent, it's useless. This means you didn't put much more effort to explain more about it. And here give you like a sample of the consent and how to give it to the patient. You can read at your convenience. And then the last one, speaking about some topic here, it's not extremely important, but like it's obtaining, again, explaining more about the consent and how to obtain it from the patient. And the decision should be taken for you. If the legal guardian is not here, risk factor, alternative. So I'm not going to say it again for you. And then like, okay, this is the point here, extra point in this one is dentists are advised that the more complicated or risky the treatment is, the more specific and detailed the consent and its documentation should be. Like, this also applies to treatment undertaken for strictly cosmetic or aesthetic reasons. Mean like the consent form for a filling, posterior filling or any filling should be like patient consented and that's it. But the consent form for a filling aesthetics, like veneers for upper anteriors or custom made veneers in a lab, porcelain veneers or a composite veneers, this one you should add more details about it. So strictly cosmetic or aesthetic reason should have more details in the consent. Okay? Patient understood by the information is given. Patient is good for that. So again, there is no fixed age of consent for medical treatment. And the tricky we said before, like 18 and above is good. And 12 should be, you should take it from the guardian or the parents. So the tricky part here, for patient under the age of 12, consent should be obtained from the parents or guardian of the child. For patient age 16 or above, the dentist should presume, in the absence of the evidence of the contrary, that the minor can provide a consent on his or her own behalf. The most difficult determination of the patient between 12 and 15, and to cut it short for you, the article mentioning like if you going to do routine treatment is good, you can proceed with that. If you are going to do complicated treatment, if you are going to do extraction, if you are going to do Invisalign treatment, even if the patient is 16 years old, no, you cannot do this. You should go back to his parents or the guardian to get the consent. Anyway, no person under the age of 18 can enter into a legal binding contract. That means that a payment arrangement entered into with a minor cannot be enforced. So you cannot tell his parent, okay, you're sending him a bill of 6K for Invisalign treatment. The parents can sue you because like you cannot, even 16 years old, you can do it. You can do treatment, but you cannot hook the patient with agreement, because like Invisalign treatment or orthodontic treatment is an agreement, or implant is an agreement between you and the patient. Okay, circumstances should be recorded in the notes you are going to do, and then whether the substitute decision maker has been given a power of attorney for the personal care for the patient, meaning like not every patient coming to you with like from a facility for mental institute, he coming to you, this mean he is the legal guardian. Maybe he's coming with you, but the legal guardian for this patient is his brother or his sister. So this one coming for with him cannot give you the consent. You should contact his brother or sister over the phone to get the consent, or the best practice here to ask the patient to come first time with his legal guardian to get the consent for treatment, but later on he can come with the caregiver. And if any change, I think you know the answer. Okay, last point here. Patient has the right to challenge a dentist's opinion about his or her capacity by requiring a review to the consent and capacity board within 48 hours. Meaning like patient come to you with a dementia, and the healthcare worker come showing you the legal guardian, the custody, and he's showing you official paper about it. But for random reason, the patient said, no, I have the capacity and I want to refuse the treatment. So you say, no, I have a document, I will not respect your wish. No. And this patient has some mental problem. He has the file showing in a clear way he has some mental issue, and the caregiver coming with him giving you the paper, official paper for everything. Even in this circumstances, if patient say no, you should respect him and give him 48 hour. In this 48 hour, the patient will go to a legal board to to hear to him. To hear to him within 48 hours. If the patient tells the dentist that he or she intends to challenge the opinion, unless it is an emergency, the dentist should refrain from treating the patient until the application is filled and determined. If the application is not filled within 48 hours, the dentist may rely on the consent of the substitute decision maker and complete the treatment. So it's not forever. You give him 48 hours, he can go to the court and then you get the decision unless it's an emergency treatment. So these three articles is very simple, but the question might be like weird for you because we don't have knowledge, a lot of knowledge about this stuff. So I would like you to go back and watch the video. I think it's beneficial and will answer, I think, most of your question about this topic. Feel free to leave me a question or a comment. Feel free to share the video with other dentists going to the exam. And as usual, have a good day.